Lesson number 10, Health Reimbursement Account Basics. Hi, it's Mike. How are you doing today? I hope you're doing well. Thank you for coming by, and it's good to see you again. This will be a quick lesson about health reimbursement accounts. Let me just start with a very simple definition of what a health reimbursement account is. It's an employer-funded plan that reimburses employees for incurred medical expenses that are not covered by the company's standard insurance plan. What it basically is, or what it basically functions as, is a supplemental health insurance plan, okay? It covers some things that regular health insurance does not cover. Because the employer funds the plan, any distributions are considered tax deductible to the employer. Reimbursement dollars received by the employee are generally tax-free. Now, there is a downside to HRAs, and I want to go over this very quickly with you. Companies can choose to start or fund HRAs pretty much anytime they wish. Also, please be advised that the employer has the right to cancel it at virtually any time. Yes, HRAs are used by companies to control healthcare costs, but if there are too many claims and it becomes too expensive for them, there is a possibility that the company can cancel the plan. In addition, unused amounts may be rolled over to be used in subsequent years. Please remember that the employer funds and owns the account. Health reimbursement accounts are sometimes called health reimbursement arrangements. HRAs are designed to give employees more choice and greater control over their health care coverage. But just remember, the employer sets the parameters for the health reimbursement accounts, and unused dollars remain with the employer. They do not follow the employee to new employment. Keep that in mind if you are laid off, you quit, or you're fired, or whatever. Please keep that in mind. Because the reimbursements occur pre-tax, employees and employers often save up to 50% in combined taxes on the cost of medical expenses. That's something to think about, and that's something to consider, and that's why I'm mentioning it right now. Usually when an employer hires a new employee, within 2 or 3 months, they are offered enrollment onto an HRA, to a health reimbursement account. And just understand, though, that the employer can terminate the plan just about any time. Or if you decide that, you've been there for 6 months, you've been there a year, and you don't like it anymore or whatever, and you want to leave, that money is the employer's, not yours. Keep that in mind. Here's a little bit of advice for you. Make sure that, particularly if you're a new hire, and you go to a new job and you like it and whatnot, you decide, I want to stay here. Understand that there are many different things that these plans pay for and don't pay for, and that's at your employer's discretion. So make sure that when you have your talk with human resources, that you understand exactly what you're getting into and exactly what the terms of this arrangement will be. Don't just walk in there and expect everything to be figured out for you. You have to do some research. You have to talk with human resources and see exactly what your employer will and will not pay for. That concludes this lesson for today, and I hope that it's given you some kind of background about HRAs. If you have any further questions, go to your human resources official, your benefits officer, and see exactly what they're offering. Thank you so much for your time today. If you like what you've heard so far, please subscribe, like, and comment. Take care and be well.